Hello and good evening everybody. My name is Dr. Amirtha Rao. I am a plastic and microvascular surgeon practicing in Trivandrum, and I specialize in post-oncoplastic reconstruction. I am here today to talk about breast reconstruction. What is breast reconstruction and who needs it basically? Breast reconstruction is reconstruction of a deformed breast to achieve ideal shape and form and aesthetics. Most commonly, it is patients who suffer from breast cancer who need breast reconstruction. We have to understand that breast reconstruction is just to restore form, shape and aesthetics. We cannot restore breast function through reconstruction. That is, the reconstructed breast a woman will not be able to lactate with a reconstructed breast. Treatment of breast cancer has seen a paradigm shift over the last 100 years. Initially, when the treatment of breast cancer was started, it was started with radical mastectomy, that is, removal of the breast and the surrounding complete skin and muscle in toto. Today, from that, we have reached either breast conservation surgery or skin sparing mastectomy, followed by breast reconstruction. Worldwide, standard of care today includes breast reconstruction for whatever surgery has been done for the treatment of cancer. Who can undergo breast reconstruction? Any patient or any woman who can tolerate general anesthesia can undergo breast reconstruction. Today, because of safe anesthesia, almost any woman of any age can undergo breast reconstruction. Now, why do we need breast reconstruction? Breast is a symbol of female shape and form. Every woman likes to look herself in the mirror, and in the absence of breast, feels slightly incomplete. So, for the psychological impact that breast removal has post cancer treatment, breast reconstruction is essential. The psychology of a patient plays a very vital role in the treatment of cancer. How the patient responds to the treatment of cancer. For body shape and image, also breast reconstruction is very essential. As younger and younger women today suffer from breast cancer, and they find it very difficult to go back to normal life that was before their diagnosis, pre-diagnosis lifestyle, to go back to work and career after breast removal is very difficult. They find it very psychologically difficult. Breast reconstruction helps to overcome all these issues. Any woman who desires to have a reconstruction should have a reconstruction. The option should be available to each and every woman. There may be some women who choose not to have, but any woman who desires to have breast reconstruction must have the option of the same. So what are the problems that we face? Lack of awareness of this option is one of the major problems that we face, and which we aim to solve with these talks. Breast reconstruction is possible for each and every woman who has breast cancer, and can be modified to the treatment of cancer. Breast reconstruction does not negatively affect the treatment of cancer. Every physician and surgeon treating cancer today, we sit together and treat breast cancer as a team. So breast reconstruction in no way negatively impacts the treatment of cancer. So when can she have breast reconstruction? It can be either primary, that is during the surgery for cancer, which is ideal and which is also covered by insurance, or secondary, that is after the whole treatment of cancer is over, she can have reconstruction later, but primary is ideal. Now comes to the next most important question: who is qualified to do breast reconstruction? Only a plastic surgeon trained in post-oncoplastic breast cancer reconstruction is qualified to do breast reconstruction. So today the team, initially when we started with the treatment of breast cancer, there were basically only two people involved in the treatment of cancer. That is the cancer surgeon who was involved in the surgery of cancer, and the oncologist who was involved in both the radiation and the chemotherapy of cancer. Today that is not the case. Today we have a team that treats any woman who suffers from breast cancer. The team includes an oncosurgeon who treats the cancer, a radiation oncologist who gives radiation specific to that cancer, a medical oncologist who gives chemotherapy and hormonal therapy for that cancer, and a reconstructive surgeon who reconstructs a customized reconstruction for the patient with cancer. So it is important to include a reconstructive surgeon in the team that treats breast cancer. I would like to conclude by saying that reconstruction is an essential part of treatment of breast cancer, and hence every cancer team must include a reconstructive surgeon, and every patient must discuss all the reconstructive options with a reconstructive surgeon, just like she discusses all the cancer treatment options, so that she knows what exists and what can be done for her along with this for this diagnosis. Because the diagnosis of breast cancer is not the end of anything. There is life after cancer, so we must aim to improve quality of life after the treatment of cancer.
ഈ രോഗത്തെക്കുറിച്ചും രോഗചികിത്സയെക്കുറിച്ചും ആധികാരികമായിട്ടുള്ള അറിവ് ഇനിയും നിങ്ങൾക്ക് ലഭിക്കുന്നതിനായി ദയവായി ഞങ്ങളുടെ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക, കൂടെ ബെൽ ബട്ടൺ കൂടി അമർത്തുക.